I managed a hospital patient in comas, and her chance of waking up was remote. Her family decided to end life support abruptly. I walked into the room where he was kept, and she was gone. No one saw her leave, or saw any of her. We all assumed this was a freak accident, until it happened again, and again, in the same room. I told my boss, but he said we couldn't just shut down a perfectly functional hospital room over a superstition, and that if I told patients about this it'd be fired. We did our best to not put anyone in that room if we could help it, and there was always a sense of dread when someone went inside, and a sigh of relief when they were still there later. Things went on like this for a few weeks until while I was having lunch, there was a sound of broken glass and banging. I ran to the source, and the patient in room 203 had thrown a rock through the window of their door and was now furiously knocking. But when we ran to see what was going on, there was no one visible inside the window. And when we opened the door, the knocking stopped. They all left, but a coworker of mine looked at the pillow in horror. I turned to see what he saw, and there was a hint of red. We walked over to see what it was, and there, placed dead center in the pillow, was 5 freshly pulled teeth, covered in blood at the tips. After that, this coworker decided that he has to stay inside, while no one watches, to see what happened. We got in after hours, and tied a rope to himself, and pushed it through a gap in the wood covering the broken window. He gave me a box and said, if he doesn't come out, to follow the instructions inside. I held the rope, and we communicated slowly through Morse code by tugging the rope. Danger. No. Danger. No. Find anything. No. Then he stopped tugging. I tugged back to see if he was okay, and then, after 5 minutes, he signaled SOS, again and again. I yanked on the door, and it wouldn't open. I tugged the rope again, and eventually it stopped resisting. I pulled it all out, and the tip was mangled like it had been chewed on, and the room was empty like was never there. The next day the press was here, reporting on the bloody crime scene in room 203. The box he gave me went to good use after all. I quit my job, not wanting anything more to do with this and not wanting to be connected to the incident. And the last I heard of it, the room had been wallpapered over.